Heads up.
Bonjour à tous. Hi everybody. Welcome to the National Press Theatre pour cette conférence de presse. On commence par des déclarations. D'abord le ministre Champagne, ensuite la ministre Hajdu, ensuite Dr Tam et ensuite Dr Nou.
Merci d'abord à vous d'être avec nous ce matin. Thank you for being with us here this morning. Comme nous l'avons annoncé hier en fin d'après-midi, le gouvernement du Canada a sécurisé les services d'un avion pour rapatrier les Canadiens qui se trouvent à bord du Grand Princess, qui doit arriver plus tard aujourd'hui dans le port d'Oakland, en Californie. Cette décision a été prise à la suite de la demande du gouvernement des États-Unis de rapatrier les ressortissants étrangers à bord de ce navire où s'est déclarée une éclosion du COVID-19. Nous avons travaillé en étroite collaboration avec nos partenaires américains afin d'assurer le retour au pays de nos Canadiens et de nos Canadiennes le plus rapidement possible et évidemment de façon sécuritaire. L'aéronef transportera les passagers de Oakland jusqu'à la base des Forces canadiennes à Trenton, où ces derniers seront ensuite évalués et soumis à une quarantaine de 14 jours. Les passagers feront l'objet d'un dépistage des symptômes avant de monter à bord de l'appareil. S'ils présentent des symptômes, ils ne seront pas autorisés à monter à bord et feront plutôt l'objet d'une évaluation plus approfondie afin de déterminer les prochaines étapes. Cette démarche illustre l'engagement et la mobilisation du gouvernement du Canada face à la crise du COVID-19, ainsi que notre étroite collaboration avec le gouvernement américain pour limiter la propagation du virus en Amérique du Nord. Je souhaite d'ailleurs profiter de l'occasion d'aujourd'hui pour encore une fois remercier tous les partenaires et les fonctionnaires, dont ceux de nos consulats à San Francisco et Los Angeles, pour leur travail des derniers jours afin d'appuyer le rapatriement des Canadiens qui se trouvent à bord du Grand Princess. En terminant, j'insiste pour rappeler à tous les Canadiens et les Canadiennes qui nous regardent aujourd'hui et qui envisagent un déplacement de l'importance de prendre le temps de consulter nos avis aux voyageurs et de s'enregistrer auprès du service d'inscription des Canadiens à l'étranger afin de recevoir les dernières mises à jour du gouvernement du Canada concernant le COVID-19. La santé et la sécurité des Canadiens et des Canadiennes, tant au pays qu'à l'étranger, demeurent notre priorité numéro 1. So as we announced late yesterday afternoon, the Government of Canada has secured the services of a plane to repatriate Canadians on board the Grand Princess, which will dock later today in the Port of Oakland in California. This decision was made following a request from the government of the United States to repatriate foreign nationals aboard this ship, which has experienced an outbreak of COVID-19. We have been working in close collaboration with our American partners to ensure the return of our Canadians as quickly and as safely as possible. The aircraft will transport passengers from Oakland to Canadian Forces Base Trenton, where they will be assessed and quarantined for 14 days. Passengers will be screened for symptoms before boarding the aircraft. If they exhibit symptoms, they will not be allowed to board and will instead be assessed further to determine next steps. This illustrates the commitment and mobilization of the Government of Canada in the face of COVID-19 crisis, as well as our close collaboration with the U.S. government to limit the spread of the virus in North America. I would also like to take this opportunity once again to thank officials and partners, including those from our consulates in San Francisco and Los Angeles, for their work over the past few days to support the repatriation of Canadians aboard the Grand Princess. In closing, I would like to remind all Canadians which are watching us today and who are considering traveling of the importance of taking the time to consult our travel advisories and to register with the Registration of Canadians Abroad Service in order to receive the very latest updates from the Government of Canada regarding COVID-19. The health and safety of Canadians, both at home and abroad, remains our priority. Minister.
Thank you, Minister. Bonjour à tous. Merci d'être avec nous. Le plan présenté par la ministre Champagne va nous assurer que les mesures nécessaires soient en place pour contenir le virus. Nous avons pris cette décision pour protéger tous les Canadiens. As with our previous repatriations, passengers will be screened for symptoms before boarding the plane. If they exhibit symptoms of COVID-19, they will not be permitted to board. They will be cared for by the U.S. healthcare system, and our consular services will remain in close contact throughout the duration of their illness. All returning Canadians will continue to be assessed for symptoms of COVID-19 through a 14-day quarantine at CFB Trenton out of an abundance of caution and to ensure the health and safety of all Canadians. Each repatriated Canadian or family will be housed in separate accommodations to reduce potential exposure to other quarantined individuals. And if quarantined individuals remain asymptomatic throughout the 14-day quarantine period, they pose no risk to others and they will be able to return home. We will monitor their health and we will make their stay as comfortable as possible. I'd like to thank the Canadian Armed Forces at CFB Trenton, the staff of the health portfolio, the province of Ontario, our partners helping on the ground, as well as our Chief Public Health Officer, Dr. Tam, for all of their hard work and dedication. And I now like to invite Dr. Tam to say a few words on the public health assessment of cruises.
Thank you, Ministers, and good morning, everyone. As usual, I'll begin with a brief update on the evolving situation globally and cases in Canada. Globally, there are now over 110,000 confirmed cases in over 100 countries. In Canada, as of right now, we have 71 confirmed and presumptive cases of COVID-19 reported nationally, including 34 in Ontario, 27 in British Columbia, 4 in Quebec, and 6 in Alberta. Most of Canada's cases include travelers from an affected area or their close contacts. In addition, colleagues in British Columbia have identified 2 cases of COVID-19 in residents of a long-term care facility as part of their investigation into an individual who contracted COVID-19 in the community. New cases in Canada also include 6 individuals connected to the first leg of the Grand Princess cruise ship voyage who were on board between February 11th and the 21st. Given that cases of COVID-19 have now been identified amongst passengers currently on board the Grand Princess, any asymptomatic individuals repatriated to Canada will be quarantined for 14 days. We are also aware of a Canadian with COVID-19 in the Dominican Republic. This individual was a guest at a hotel where one other case linked to Italy had previously been reported. As a result, we have identified travelers who stayed at the same hotel from February the 22nd to March the 7th and have asked them to self-isolate for 14 days as a precautionary measure. I've asked Canadians to think twice about going on cruise ships. Today, the Public Health Agency of Canada is recommending that Canadians avoid all cruise ship travel due to COVID-19. Cruise ships have passengers from around the world who may be arriving from areas with known or unknown spread of the novel coronavirus. The virus can spread quickly on board cruise ships due to the close contact between passengers. Older people and people with a weakened immune system or underlying medical conditions are at a higher risk of developing severe disease. Because of the ongoing expansion of COVID-19 outbreaks worldwide, for the time being, the risk to the general population within Canada is still low, but this could change rapidly. We are most concerned for Canada's vulnerable populations. It is very important for all travelers coming to Canada to self-monitor for symptoms of COVID-19 for 14 days and avoid places where you cannot easily separate yourself from others if you become ill. Stay home if you're sick and call ahead to health lines or public health authorities before seeking medical care. We must all do our part to reduce spread of COVID-19 and protect our most vulnerable groups, including anyone in long-term care facilities and our hospitals. As well, the risk of infection is increased for certain settings, such as travel to the most affected areas, international conferences, large gatherings in enclosed spaces. So we continue to work closely with health authorities internationally, across Canada, and at all levels of government to assess the risks and keep Canadians informed on what we can all do to keep healthy and protect the most vulnerable amongst us. Thank you.
Merci au ministre, Dr. Tam, et bonjour à tous. Comme d'habitude, nous commençons par faire le point sur l'évolution de la situation dans le monde et les cas au Canada. Dans le monde, plus de 110 000 cas de la maladie ont été confirmés dans plus de 100 pays. Au Canada, à l'heure actuelle, l'on dénombre 71 cas confirmés et présumés de COVID-19 à l'échelle nationale, soit 34 en Ontario, 27 en Colombie-Britannique, 4 au Québec et 6 en Alberta. Dans la plupart des cas, il s'agit de personnes qui ont voyagé dans l'une des régions touchées ou des personnes qui ont eu des contacts étroits avec elles. De plus, des collègues en Colombie-Britannique ont identifié 2 cas de COVID-19 chez les résidents d'un établissement de soins de longue durée dans le cadre de leur enquête relative à une personne ayant contracté la maladie dans la communauté. Les nouveaux cas au Canada comprennent également 6 personnes qui se trouvent à bord du navire Grand Princess du 11 au 21 février lors de la première partie de la croisière. Comme des cas de COVID-19 ont été identifiés parmi les personnes qui se trouvent actuellement à bord du navire Grand Princess, toutes les personnes asymptomatiques qui seront répatriées au Canada seront mises en quarantaine pour une période de 14 jours. Nous savons également qu'une personne d'origine canadienne est atteinte de COVID-19 en République dominicaine. Cette personne séjournait à l'hôtel où un autre cas lié à ce en Italie avait déjà été signalé. Nous avons donc identifié des voyageurs qui ont logé au même hôtel du 22 février au 7 mars et leur avons demandé de s'isoler pendant 14 jours par mesure de précaution. On demande aux Canadiens de bien y penser avant d'aller en croisière. Aujourd'hui, l'Agence de la santé publique du Canada recommande aux Canadiens d'éviter les croisières en raison de COVID-19. Les croisiéristes proviennent de partout dans le monde et pourraient arriver d'une région où l'on sait ou non que le nouveau coronavirus se propage. Ce dernier peut se propager rapidement à bord des navires de croisière en raison des contacts étroits entre les passagers. Les personnes âgées et les personnes dont le système immunitaire est affaibli ou qui présentent un problème de santé sous-jacent sont considérées comme étant plus à risque de maladies graves. Comme l'épidémie de COVID-19 continue de se répandre dans le monde, à l'heure actuelle, le risque au Canada pour la population générale est faible, mais la situation pourrait changer rapidement. Nous nous préoccupons surtout des populations vulnérables au Canada et on demande maintenant aux personnes qui présentent un risque accru d'exposition au COVID-19 de limiter les déplacements et d'éviter les foules. Il est important que tous les voyageurs qui arrivent au Canada de surveiller les symptômes de COVID-19 pendant 14 jours et qu'ils évitent tout endroit où ils ne peuvent pas facilement s'isoler des autres s'ils deviennent malades. Restez à la maison si vous êtes malade et communiquez avec les lignes InfoSanté et les autorités de santé publique avant de consulter un médecin. Nous avons tous un rôle à jouer pour éviter la propagation de COVID-19 et protéger les personnes les plus vulnérables de notre population, y compris celles qui sont hospitalisées ou qui résident dans les établissements de soins de longue durée. Par ailleurs, le risque d'infection est plus grand dans certains contextes, notamment les voyages dans les régions les plus touchées, les conférences internationales et les grands événements qui se tiennent dans les espaces clos. Nous continuons de travailler en étroite collaboration avec les autorités de la santé à l'échelle nationale et internationale, ainsi qu'avec tous les ordres de gouvernement, afin d'évaluer les risques et de tenir la population canadienne informée des mesures que nous pouvons tous prendre pour demeurer en santé et protéger les personnes les plus vulnérables. Merci.
Merci beaucoup. Guys, you know the drill. One question, one follow-up. On va commencer avec David de Reuters.
Question, I think, first off for Dr. Sorry, I apologize. Question for Dr. Tam. The situation in the States seems to be developing quite rapidly. You have a lot of people from Quebec coming back last week from March break in the States. Next week is March break in Ontario. Undoubtedly, a lot of people will be going to the States. At what point, given what's happening down south, do you think about a travel advisory? Perhaps warning Canadians against certain parts of the States?
Well, we continue to monitor the situation, on a very much an ongoing basis. Right now, if you look at our advice, it would include all the areas in the United States that are currently experiencing cases as well. So as I've just said, that all travelers, no matter where they come from, including the United States, should be aware of this kind of information which is linked to our website. And as I've said, that everyone who comes back into Canada should self-monitor for symptoms.
And Minister Champagne, there's no doubt that if Canada did issue a travel advisory warning against travel to certain parts of the States, that would upset the White House. How complicated is it for your relationship with the States to have a potentially unhappy President Trump when you're working through these issues?
Well, let me be clear. I mean, it's science first. From day one in Canada, thanks to Dr. Tam and Minister Hajdu and the whole of government, we have been guided by science. We have been guided by the World Health Organization advisory, and we're continuing to work with our Five Eyes partner. In the case of the Grand Princess, as you could see, we have been in touch with our U.S. colleagues to make sure that not only we protect the health and safety of Canadians, both at home and abroad, but we also are mindful of how we can protect North America from the spread of the virus. So I would say our relationship and our interaction is going well. It's almost daily at all levels of governments to make sure that we protect the safety of all Canadians.
J'ai oublié de mentionner, on a encore le petit problème de micro, donc je vais nommer la personne qui a la question et la suivante, comme ça va pouvoir faciliter le roulement. Lina Dib de la presse canadienne, ensuite ce sera Joyce Napier de CTV.
Bonjour. Monsieur Champagne, je me demande pourquoi avoir attendu aussi longtemps, je sais que c'est plus Dr. Tam, mais pourquoi avoir attendu aussi longtemps avant de donner un avis sur les croisières? Parce que ça fait des semaines que le gros problème de croisières était dans notre face, au large du Japon. Alors pourquoi tout ce temps-là avant de dire aux gens « allez pas en croisière » ?
D'abord, je vais laisser la Dr. Tam peut-être vous répondre plus précisément, mais là-dessus, je pense que le Canada, avec les autorités américaines, depuis le début du coronavirus, nous sommes en contact régulier avec aussi nos partenaires à l'étranger. Si vous regardez notre réponse, que ce soit dans le cas du Diamond Princess ou aujourd'hui dans le cas du Grand Princess, vous voyez que les autorités canadiennes travaillent de concert avec les autorités américaines. On est les premiers, je veux dire, on est vraiment le pays avec les autorités américaines qui a pris les premières mesures pour s'assurer, par exemple, que le désembarquement des Canadiens et des Canadiennes se fasse rapidement. On parle que l'avion qui rapatrierait les Canadiens et les Canadiennes partirait selon les dernières estimations du moment que le navire pourra accoster vers 21 h ce soir pour arriver à Trenton vers 5h15 du matin. Alors, vous voyez que les Canadiens vont être en processus de désembarquement en même temps que les autorités américaines. Moi, je vous dirais que le Canada est au premier plan de la réponse mondiale pour protéger les Canadiens, non seulement chez nous, mais à l'étranger. Mais peut-être que ma collègue, la ministre Hajdu, le Dr Tam, voudrait ajouter sur votre question.
Why did it take so long before giving advice against cruise ship travel? Because we saw what happened in that cruise ship in Japan. It's been weeks. So why just today?
Well, I think we provide advice to all travelers, no matter what setting. But as you know, that the global situation changed quite rapidly, even from the time of the Diamond Princess cruise ship to now. Many more countries are now affected, whereas at that point in time, there was not as many. But we always have to learn continuously from the experiences that have taken place, including that of the Diamond Princess, which is why I think the moment that something was noted in terms of cases on this particular cruise ship, international communities acted rapidly. So I think it's really a constant learning from the very rapidly evolving situation. And I think that this is a precautionary measure that we absolutely support from a public health perspective.
Joyce, c'est moi. Thank you. About the passengers on the latest ship, you said that those who present symptoms will remain in the States and be treated in the United States. So do you know if they're going to a military base in quarantine? Is it a civilian hospital? And what kind of agreement do you have with the Americans? How many days will they keep them there? How will they be treated? Do you have specific agreements with the U.S. about that?
So, so in terms of passengers that are currently symptomatic, those passengers will not be allowed to board this plane. We're working with the U.S. authorities right now to determine the severity of illness that people might be experiencing, whether or not they can self-isolate for 14 days or longer, depending on their symptoms, how we'll work through supporting those folks. And I know that Consular Services is working very closely with the individuals that are affected. And we'll have more to say as we work through those details with the Americans. But we have been very clear with our American partners that we expect that those Canadians receive the appropriate level of care. And of course, we'll be in touch with them as well on the health side.
And about, Canada's critical care facilities. So we know by covering federal, provincial conferences, the provinces have told you in Mississauga lately that their healthcare system is in need of more funds from the federal government. So I'm wondering if our critical care facilities across the country are ready to receive, should there be a big outbreak in Canada. Do we have enough respirators? Do we have enough capacity or for testing or testing kits or whatever it is that we do have? And do we have enough beds? Do we have enough people? Do you feel really confident that your healthcare system as it stands today will be able to handle this?
So two parts to that question. I think it's very important that we don't confuse the requests of provinces in terms of general health transfers with what we are facing right now, which is the potential surge on demands. It is a significant difference. Secondly, I think it's important to know that these are the conversations we've been having, both through the health ministers and now with the Prime Minister and Premier. We are very alive to the fact that some provinces are indicating that they have deficits, and we are gathering that information, and we have said all along that we will be there as a federal government to support them with the resources they need, whether those are financial resources or practical resources. You mentioned kits, personal protective equipment, ventilators. Dr. Tam can speak a little bit about the components of the testing kits. So we are in the process right now of ensuring that we understand where those potential deficits will be from province to province, and we obviously have supply on hand of some of the materials and are doing the assessment right now with provinces in terms of what their particular needs are as it relates to a surge in capacity related to COVID-19. Did you want to add anything, Dr. Tam?
We have a federal, provincial, territorial special advisory committee on COVID-19, and as part of that, the discussions there, we facilitate and coordinate discussions on supplies from the provinces and territories, including laboratory networks as well. So all provincial laboratories are connected together with our National Microbiology Lab, and they have not indicated any issues with supplies right now, but that doesn't mean we shouldn't proactively plan for what the escalations are up and coming. So this is a very sort of ongoing assessment in terms of supply requirements. But as you've seen, provinces have done an incredible job in expanding their testing in Canada.
Merci. Louis Blouin, ensuite tu seras Christy Kirkup.
En français, j'aimerais savoir est-ce que en fait le niveau de préparation en termes de santé publique est égal d'une province à l'autre? Et est-ce qu'il y a des provinces qui vous ont exprimé des besoins particuliers? Peut-être, M. Champagne, j'aimerais ça vous entendre là-dessus. In English, I'd like to know if the level of preparedness from a province to the other is the same at this point, and was there any requests that were made by the provinces at this time?
Listen, that is underway right now, and I have a regular weekly meeting with my counterparts, health ministers, and this is a standing item on our agenda. I've also sent out formal letters, as you know, to the provinces and territories to let them know that we are here for them and that we are preparing federally in terms of what our anticipated demands might be, and also to advise me in terms of what other needs they have. As Dr. Tam mentioned, this is happening at the technical level as well, and I know that the Prime Minister has written to the premiers and has reminded them that this is going to be very useful information. As of this time, provinces and health ministers have said that they are grateful for that support, that they feel confident that the federal government will be there to support them if they see an unanticipated surge, or if they have specific challenges around needs that they may feel that they have a deficit of. Howard, did you want to answer that in French?
Non, oui, OK. À l'échelle technique, on continue à travailler étroitement avec nos homologues des provinces et territoires. Comme Dr. Tam a constaté, une comité consultative spéciale avec tous les médecins hygiénistes en chef des provinces et territoires. Jusqu'à date, on a eu des bonnes discussions et aucune province a signalé qu'il y a un problème avec capacité jusqu'à date. Mais on continue avec nos conversations et si jamais au fur et à mesure il y a un besoin, on est toujours prêt à l'échelle nationale, le gouvernement fédéral, à supporter les provinces et territoires.
I think to that answer, I think what I'd like to tell Canadians is that your officials and your politicians are working incredibly hard to be ready should we see a surge in any community. This is top of priority for all governments, including local governments. And so I want to thank all of those professionals and the leaders, the political leaders that are taking this so seriously and doing that hard work. This is the work that has to happen, undoubtedly, and it is happening. And Canadians can be assured that the people that are in charge of these various health systems are extremely hardworking and working very diligently to determine their capacity and their readiness.
Les douaniers ont demandé davantage d'encadrement, d'éducation aussi pour gérer cette crise-là. Est-ce qu'il y a eu des mesures qui ont été prises pour rassurer les douaniers au Canada?
D'abord, juste pour répondre à votre première question, on le fait à tous les niveaux. La ministre Hajdu le disait. Moi, par exemple, j'ai parlé à la ministre Giraud dès qu'on pensait rapatrier, évidemment, les Canadiens sur le Grand Princess. Donc, ce que la ministre Hajdu disait, que le Dr. Tam, ça se passe à différents niveaux, au niveau autant, j'allais dire, politique, au niveau des officiels, à tous les niveaux du gouvernement, parce que la réponse qu'on doit faire présentement, c'est une réponse qui encadre autant au niveau fédéral, provincial et j'allais même dire municipal pour s'assurer qu'on soit là pour répondre. Pour votre question pour les douaniers, évidemment, on est toujours en train de regarder les mesures qui peuvent être mises en place. C'est une situation qui évolue. On est en discussion, comme vous pouvez imaginer, pour voir les meilleurs moyens qu'on peut prendre. Parce que quand on parle d'assurer la santé et sécurité des Canadiens et des Canadiennes, c'est de tous les Canadiens et les Canadiennes. Donc, évidemment, ceux qui sont sur la première ligne, c'est-à-dire ceux qui offrent des services pour soit rapatrier les Canadiens ou soit, évidemment, offrir des services médicaux. Alors, c'est sûr que ça fait partie des discussions que l'on a avec les différentes autorités, mais les différentes agences aussi qui ont un rôle à jouer dans le rapatriement des Canadiens.
Christy. Ensuite, ce sera Marie Vastel. Il nous reste une dizaine de minutes, alors gardez les questions et les réponses courtes, s'il vous plaît.
Good morning, Christy Kirkup with the Globe and Mail. You mentioned off the top that the travel advisory, specifically to the United States, that there's no planned change there. Can you just help us to understand why that is? Is it because COVID-19 knows no borders, and is that kind of part of the approach that you're giving the public health advice? Because this can go anywhere at this point.
Well, our travel health advice or travel health notice is based on the existing data. So, of course, we will be monitoring every part of the United States like we would any part of the world. But we will, our advice will be focused on specific area of the United States as opposed to the whole of the United States. That would be the most appropriate approach. So right now, none of them are at an increased level of travel health advisory, but that doesn't mean that it couldn't happen. It's just that it's right now. I mean, if you can't compare, maybe another country with much higher cases than what is happening in the United States, but we are taking the precautionary approach to warn all travelers, as I've just said.
And Dr. Tam, I heard what you said on Friday that people should think twice about getting on a cruise ship. Today you're saying public health agency is kind of going further to warn Canadians against cruise ship travel. The government obviously announcing this weekend you're repatriating Canadians that are stuck on the Grand Princess. If Canadians decide to maybe not take the advice of the public health agency, are you still going to order up a plane and to go get those Canadians? What's the policy in place specifically around also taxpayers are involved in dealing with this very sensitive situation? Now that the advice has been issued to not go on cruise ships, are you still gonna go and get them if they're in a situation where they need some help?
Well, first of all, let me be very clear for all of those watching at home. This is going to be done on a cost recovery basis. So I have talked to the CEO of Island America, and we have agreed that the cruise line will be assuming the costs of the plane to repatriate Canadians. So this is done on a cost recovery basis, and the cost will be borne by the cruise line. In the case that we have, obviously, as people watching at home, we have to look at the situation case by case. This is a very exceptional circumstances. First of all, we had a specific request from the United States government. We are dealing in a cruise ship environment, and everything we have learned, as Dr. Tam said so far, suggests that we take measures which are exceptional. And we're also acting to prevent the spread of the virus in North America. So these circumstances have led us, obviously, to take a specific set of actions. If you compare the case, what's going on in Italy, for example, in Iran, there's still a number of commercial means for Canadians to get out of these regional areas where, obviously, there's an outbreak of the coronavirus. But you're quite right to say that, as we have said to Canadians now, that the advice from the Public Health Agency of Canada and Minister Hajdu and the whole of government is for Canadians to avoid travel on cruise ship. People would be on notice, obviously, of the danger associated with getting into a cruise line at this stage. And therefore, we will look at cases on a case-by-case basis because all of them depend. But I would say on this one, there were a number of exceptional circumstances which have led us to work with the U.S. authority to secure a plane. And this is being done on a cost recovery basis in accordance with our discussions with the cruise line.
Marie,
Sur les coûts,
non, Marie.
En fait, je voulais vous relancer là-dessus. C'est pas très clair dans ma tête, votre réponse, M. Champagne. Donc, si je comprends bien, vous dites, maintenant, les gens vont être avertis qu'ils ne devraient pas aller sur une croisière. Êtes-vous en train de dire qu'à partir de maintenant, s'il y a des gens qui sont sur une croisière, c'est un peu à vos risques et périls, vous devrez revenir par vos propres moyens? And just a follow-up, I don't remember who answered this, but on the quarantine in the U.S., who is paying for medical treatment in the U.S. for those people? Would it have to be their own insurance? Is it the U.S. or is it the Canadian government?
Si vous me permettez, sur votre première partie de la question, je pense que j'ai dit c'est le gros bon sens qui s'applique. Du moment que les autorités canadiennes avisent les Canadiens et les Canadiennes d'avoir extrêmement de prudence avant d'embarquer sur une croisière, je pense que les gens qui nous regardent à la maison comprennent qu'à ce moment-là, on vient de donner un avis formel que ce n'est pas dans l'intérêt des gens de voyager présentement. Ce que j'ai dit sur le rapatriement des gens sur le Grand Princess, c'est que ça va être fait à coup nul pour le gouvernement du Canada, c'est-à-dire que l'avion qui sera affrété, le coût associé à l'affrètement va être assumé par la compagnie, c'est-à-dire Holland America, qui s'est engagée à assumer le coût de l'appareil pour rapatrier les gens chez nous. Et dans ce cas-là, on était face à des circonstances exceptionnelles. C'est ça que je veux dire aux gens. D'abord, on avait une demande express du gouvernement américain qui nous demandait de rapatrier les Canadiens et les Canadiennes à bord. Deuxièmement, on était dans un environnement de croisière et on l'a vu, comme la Dr Tam a dit, on a appris des circonstances particulières sur les croisières. Et troisièmement, on a agi pour prévenir la propagation du virus en Amérique du Nord. Ceci dit, on va toujours regarder les situations cas par cas, mais je pense qu'aujourd'hui, les Canadiens et les Canadiennes sont avisés de reconsidérer les plans de voyage qu'ils pourraient avoir pour des croisières.
On the question of Canadians who are symptomatic that can't travel, first I will say that every situation will be different, and we're assessing right now what people's personal situations are, how ill they are, whether or not they will need to be hospitalized, whether or not they will be able to self-isolate, potentially in a hotel. But I will remind Canadians that when they travel and adverse events happen, that is why we have things like travel insurance and other kinds of precautions that we put into place when we travel, because unanticipated events can happen regardless of whether it's an illness or other kinds of events. Obviously, the consular services will work with each particular individual to assess their circumstances, but our anticipation is that those individuals will have to, work with the consular services and hopefully draw on the resources that they have put into place as travelers.
My other question is sort of a technical question. Maybe it's for you, Minister Hajdu. In a situation where it would become an epidemic, where is the jurisdiction? Is it federal or provincial to decide if there were to be a quarantine for a city or for an area?
So I'll answer briefly, and then I'll turn to Dr. Tam. We work very closely with provinces and territories and local municipalities to help them do risk assessments in terms of the kinds of social distancing measures that they'll take, including the potential of quarantine or cancellation of events. For example, we now have, we've had obviously documents that are available to all provinces, but there's a link now on our website on the front page that includes access to the risk assessment tool that local communities can use if they're considering canceling events or closing down public spaces. But that is largely at the discretion of the jurisdiction in which the event is being held. So whether it's at a local level or provincial level, and I'll turn to Dr. Tam to just add a few words about that.
No, that's correct. I think at the federal level and the Public Health Agency, we provide guidance and technical support. But every level of government have their own acts, public health laws, which allow them to enact any number of these range of public health measures. And it is important, I think, that you do look at the situation from the ground up. And the measures have to be balanced against what's going on the ground, and you can't sort of blanket a whole geographic area without really paying attention to the details on the ground. So I think the key is that at the local level, they need to understand their epidemiologic situation, if you like, and then act according to that data.
Je regrette pour tous ceux qui n'ont pas eu de questions, mais les ministres avaient des engagements. Alors, ceci met fin à la conférence de presse. Merci. Merci beaucoup.
One question, one follow-up. It's really hard to pursue lines of thinking. So I would, again...
I'll urge them to do that. Thank you for bringing that to my attention. I'll make sure that happens. Thank you.
Merci tout le monde.